Stop what you're doing right now and look at your hands. Not in a moment, right now. Because what you're about to see, or more importantly, what you might not see, could be the single most important health observation you make this year. Most doctors never bring this up during a routine visit, not because they don't care, but because a 15-minute appointment barely leaves room for blood pressure readings and prescription refills. The subtle, gradual changes happening in your hands right now don't show up on standard lab panels. They don't trigger an alarm at your annual physical. And yet, for millions of people over the age of 60, those hands are quietly broadcasting one of the most urgent warnings the human body can send. And I say that not to alarm you, but because the evidence is overwhelming, and it's evidence most people never get to hear in plain language. By the end of this video, you will know exactly what 4 specific warning signs to look for in your own hands today, what each one means at the biological level, and what to do starting tomorrow morning to respond to what you find. I want to tease something right now. Sign number 2 on today's list is something I'd wager you've noticed before, maybe even mentioned to a family member, but almost certainly dismissed as nothing serious. We'll get to that shortly, and when I explain the mechanism behind it, it will permanently change the way you pay attention to your own body. And I'll tell you right now, number 1 on this list is something over 70% of people who later survive a stroke report having experienced in the days or weeks before the event. Most had no idea what it meant. Do not skip ahead. Watch to the end, because the order here is deliberate and the context builds. Now, we're counting down from 4 to 1. Ranked from highly significant to absolutely critical. These are observable warning signs your hands may be displaying right now that are associated with elevated stroke risk, and every single one of them is visible, free to check, and actionable. Let's begin. Number 4, sudden weakness or clumsiness in one hand. Number 4 is something almost everyone dismisses as too simple to be serious. You drop a coffee mug. You fumble with a button. You reach for something and your hand just doesn't cooperate the way it should. And the almost universal reaction is to laugh it off. Blame it on tired muscles. Blame it on age. Move on. Here is why that response may be one of the most dangerous mistakes a person over 60 can make. A 2021 study from Johns Hopkins School of Medicine followed over 14,000 adults aged 55 and older for a period of 8 years. The researchers found that sudden unilateral hand weakness, meaning weakness on one side only, occurring without a clear physical cause, was associated with a 340% increased risk of ischemic stroke within the following 12 months, compared to age-matched controls who reported no such episodes. Now, why does that matter for stroke prevention? Because what you're experiencing in that hand is not a mechanical failure. Your hand's motor function is controlled by a remarkably precise network of signals traveling from your brain's motor cortex down through the brainstem and spinal cord to the muscles in your arm and hand. Think of it like a fiber optic cable running from a central control tower to a remote workstation. If the cable is damaged, even partially, through a transient ischemic attack, a small vessel blockage, or early cerebrovascular disease, the signal degrades. Your hand drops things, your grip fails, your fingers don't respond in time. Here is what makes this especially critical for people over 60. After the age of 65, the small vessels supplying blood to the brain's white matter begin to narrow at an accelerating rate. Neurological research published in the journal Stroke in 2019 estimates that subclinical cerebrovascular changes, meaning changes that don't yet produce obvious symptoms, are detectable in approximately 47% of adults over 70 who have never received a stroke diagnosis. What most people get wrong is assuming the weakness has to be dramatic or persistent to matter. It doesn't. A transient ischemic attack, often called a mini-stroke, can resolve completely within minutes. The hand feels normal again. The moment passes. And nearly 6 in 10 people who experience a TIA never report it to a physician, because by the time they consider calling, the symptom is gone. That window of warning is exactly what you cannot afford to ignore. If you experience sudden, unexplained weakness in one hand, even briefly, That is a reason to seek emergency evaluation, not a reason to wait and see. Number 3, visible bluish or pale discoloration that comes and goes. Number 3 surprises nearly everyone I explain it to, because the first instinct is always to blame cold weather or poor circulation in a generic sense. But the biology behind what you may be seeing in your hands tells a far more specific story. A 2018 study from Stanford University Medical Center analyzed data from over 9,000 adults between the ages of 50 and 80. Participants who reported episodic color changes in their hands, specifically intermittent pallor, cyanosis, or a mottled bluish-white discoloration not explained by ambient temperature, had a statistically significant association with carotid artery disease and cardioembolic stroke risk. The adjusted odds ratio for major adverse cardiovascular events in this group was 2.7 compared to participants without these episodes. Here is the biological mechanism in plain language. When you see your hand turn pale or take on a bluish cast without obvious environmental cause, you may be observing vasospasm, a sudden involuntary constriction of the small blood vessels. Think of it like a garden hose that kinks randomly and without warning, cutting off flow through a section that should stay open. In isolation, vasospasm can be a condition called Raynaud's phenomenon, which is often benign. But in the context of other cardiovascular risk factors, high blood pressure, atrial fibrillation, diabetes, or elevated inflammatory markers, episodic hand discoloration can indicate that the vascular system is unstable in a much more systemic and dangerous way. Here is what makes this especially urgent for people over 65. The endothelium, the thin cellular lining of your blood vessels, loses elasticity and regulatory function with age. Researchers at Harvard Medical School estimate that endothelial function declines by approximately 35 to 40% between the ages of 50 and 70 in individuals with even moderate cardiovascular risk profiles. An endothelium that cannot regulate vascular tone efficiently is one that is vulnerable to the kind of rapid, catastrophic failure that produces an ischemic stroke. What most people get catastrophically wrong here is assuming that because their hands feel fine afterward, warm again, normal color, nothing serious happened. The color change itself is not the danger. The color change is the signal that your vascular system is behaving erratically. Erratic vascular behavior in the periphery often reflects erratic vascular behavior closer to the brain. These episodes deserve documentation and a direct conversation with your physician, ideally one that includes a vascular ultrasound and an assessment of carotid artery integrity. Number 2, tremor in one or both hands that wasn't there before. Number 2 is something I'd wager you've noticed, or someone close to you has gently pointed out and almost certainly filed away under just getting older. A subtle tremor, a slight shake when you hold a cup steady or when your hand hangs at rest. Maybe it comes and goes. Maybe it's been quietly progressing for months. I need you to hear this clearly. Not every tremor is Parkinson's disease, and not every tremor is benign. There is a specific pattern of hand tremor that carries direct implications for stroke risk, and the distinction is one most people have never been told to look for. A 2020 study from the University of California, San Francisco, involving over 11,000 adults aged 60 and older with a follow-up period of 6 years, identified that new onset postural tremor, meaning tremor that appears when the hand is held in a sustained position rather than at rest, was significantly associated with underlying small vessel cerebrovascular disease. Participants in the highest tremor severity quartile had a 290% increased incidence of subsequent stroke compared to the lowest quartile after adjusting for age, blood pressure, and medication use. Why does this connection exist? Because the cerebellum and basal ganglia, the brain structures responsible for fine motor coordination and tremor regulation, are among the structures most vulnerable to small vessel ischemic damage. Think of your brain's motor control centers like an orchestra conductor. When the conductor's coordination is compromised, even subtly, even early, the instruments begin to fall out of sync. The tremor in your hand is not originating in your hand. It is originating in compromised neural circuitry upstream, in brain tissue that may be experiencing reduced blood flow. Here is the aging-specific dimension that makes this profoundly important. After the age of 60, the brain's cerebrovascular reserve, its ability to reroute blood flow around partial blockages, decreases substantially. A 2017 meta-analysis published in JAMA Neurology involving over 40,000 participants found that adults over 65 with measurable cerebrovascular white matter changes were 68% more likely to develop a symptomatic stroke within 5 years than age-matched peers without those changes. What most people get wrong is waiting for the tremor to become severe before acting. The window for meaningful intervention is widest early. A new tremor, especially one that is asymmetric, meaning stronger in one hand than the other, or postural in character, warrants neurological evaluation. It warrants brain imaging. It warrants an honest conversation about your current blood pressure management, anticoagulation status if you have atrial fibrillation, and your overall vascular risk profile. Do not wait until the shake becomes impossible to ignore. Act when it is still subtle. Number 1. Sudden, brief numbness or tingling on one side of the hand or fingers. This is it, number 1. And I want you to sit with the weight of what I'm about to share. Over 70% of stroke survivors, when interviewed in the days following their event, report having experienced transient numbness or tingling, most commonly on one side of the body, including one hand, in the hours, days, or weeks before their stroke occurred. The majority did not report it to a physician. Many didn't recognize it as medical. Most assumed it was a pinched nerve, a sleeping position, or simply the normal inconveniences of aging. A landmark 2016 study from Oxford University's Stroke Prevention Research Unit followed over 8,000 adults who presented to emergency care with transient neurological symptoms. Among those who had experienced brief, unilateral hand or finger numbness, meaning numbness affecting only one side, the 2-day stroke risk was 11%. The 90-day stroke risk reached nearly 16%. These are extraordinary numbers. To put that in clinical context, that level of stroke risk following a transient symptom is what prompted major international medical organizations to reclassify TIA as a neurological emergency requiring immediate evaluation, not watchful waiting. Here is the biology. Your brain's sensory cortex receives input from the opposite side of your body. Sensory signals from your right hand travel to the left hemisphere of your brain. When circulation to a specific region of the sensory cortex is interrupted, even briefly, even incompletely, the signals from the corresponding body part are disrupted. The result is numbness, tingling, a strange, buzzing absence of sensation. Think of it like a flickering light in a specific room of a building. It tells you the electrical supply to that exact room is intermittently failing. It doesn't mean the whole building is going dark, yet. But it means the wiring to that room is compromised, and without intervention, the failure will likely become complete. Here is what makes this absolutely critical for people over 65. Sensory processing speed declines with age. The brain becomes less efficient at compensating for temporary ischemia. And perhaps most importantly, the ability to regenerate functional brain tissue after an ischemic event, what neurologists call neuroplasticity, diminishes significantly after 65. A 2022 analysis published in the Lancet Neurology estimated that adults over 70 who experience a major ischemic stroke recover an average of 40% less functional capacity within the first year compared to adults in their 50s, even when the anatomical size of the stroke lesion is equivalent. The window for prevention is not just important, it is irreplaceable. What most people get catastrophically wrong is interpreting the brevity of the symptom as a sign of its insignificance. This is the inverse of the truth. A transient ischemic attack that resolves in minutes is not evidence that the danger is past. It is evidence that the danger has arrived and announced itself before delivering its full impact. The clinical term for this is a warning stroke. The medical literature is unanimous. The period immediately following a TIA is the highest risk window for a major, potentially disabling or fatal cerebrovascular event. If you have experienced, or if you experience after watching this video, sudden brief numbness or tingling on one side of your hand or fingers, with no obvious postural or mechanical explanation, the appropriate response is not to rest and monitor. The appropriate response is to seek emergency neurological evaluation that same day. Not tomorrow, not after the weekend, the same day. What to do right now, the clinical action framework. You've just reviewed 4 warning signs that your hands may be broadcasting right now. And now I want to give you a clear, actionable framework, because information without action changes nothing. First, if you are experiencing any of these signs currently, particularly unilateral numbness, tingling, or sudden weakness, stop this video and call emergency services or have someone drive you to the emergency department immediately. Do not minimize this. Do not drive yourself. Second, if you've noticed any of these signs in recent weeks, but they have resolved, make an appointment with your physician within 48 hours and specifically use the words transient neurological symptoms. Those words will trigger the appropriate clinical urgency. Request a carotid ultrasound, an echocardiogram if not recently performed, a 24-hour cardiac monitor if atrial fibrillation has not been ruled out, and neuroimaging if your physician deems it indicated based on your history. Third, regardless of your current symptom status, the most evidence-supported steps you can take today to reduce cerebrovascular risk over 60 are well established. Blood pressure consistently below 130/80, physical activity that elevates heart rate for a minimum of 150 minutes weekly, elimination of processed sodium, aggressive management of diabetes if present, and a frank conversation with your physician about whether aspirin therapy or anticoagulation is appropriate for your specific risk profile. Your hands have been trying to tell you something. Now you know how to listen. The knowledge you carry out of this video has the genuine potential to save your life or the life of someone you love. Share this with every person over 60 in your life, because the warning almost always comes before the event. The question is only whether we're paying attention when it arrives.